problem.
Welcome to tonight's series. Roberta Hovermel and myself, I'm Lisa Bennett. We will be presenting and giving you some information about Alaska Medicaid, getting into a little bit about TEFRA, and covering some very important information about the public health emergency unwinding related to Medicaid. It's been a big impact on families. Roberta, if you want to go to the next slide with the Medicaid unwinding. So we really want you to understand, we're not going to get into all of it. There's a lot to it, but like I said, we're going to talk about the key points to it. But it's with the unwinding, it's important to understand the impact that it has had on families, but also how we can help support families with understanding of the renewal process and how to apply for Medicaid. Some of the objectives that we will talk about tonight is understanding the public health emergency and the implications of the public health emergency ending, learn about programs and commonly used terms that are important when supporting families who are impacted by the end of the public health emergency. And Roberta is going to get into that and explain a lot of that when she takes over tonight's presentation. We also are going to explore a little bit of the impact that the end of the public health emergency is having on families across the country. So we'll give you a little bit of facts and statistics to that. So this right here gives you a good scope, a good range. CHIP is Children Health Insurance Program. So we're looking at TEFRA, or it could be Denali Care related to anyone under the age of 18 when it's related to Medicaid. And I'm just going to read just a little bit of information here that talks more about this graph. It talks about during the period from February 2020 through February 2023, monthly Medicaid and CHIP enrollment grew from 71 people to nearly 94 million people. With the end of the public health emergency and the Medicaid continuous enrollment period on March 31st, 2023, states were given 12 months to redetermine the Medicaid eligibility status for every single one. That's a lot. That is huge. Those are huge numbers. No one thought this was going to be easy, but it quickly became apparent just what a challenge this was going to be. And I don't know if you're asking yourself now, wow, did I do the enrollment? Did I renew Medicaid? When you think about families who have moved and didn't let the Department of Public Assistance know that they moved, and they had no idea that the Medicaid needed to be renewed. And they go in to get prescriptions filled, and all of a sudden they find out that they do not have medical coverage for their child. So that's what we're talking about, how we really did, in each state didn't know what the huge challenge this was going to be. So this gets into how many we're looking at, mainly the children, and looking at between April 1st, 2023 through November 8th, 2023, more than 10 million have been disenrolled from Medicaid. 38% of the disenrollments are children. So states are really looking at how can they catch up, how can they support families who their children have been disenrolled from Medicaid. And so this gets into just a little bit more of a graph that shows you how many people were disenrolled or disenrollments, and then how many were renewed. So if you look at this pie graph, there's a huge discrepancy. One of the things that I would like to share is, they were talking about just data that 21 states were reporting on age breakouts that shows just how many were disenrolled from adults to children. So not only did it impact children, it also impacted adults. So Roberta is going to get into a little bit more about what Alaska Medicaid is, what the application is all about, and where you go to turn in the application, how you turn in the application, and also she's going to cover TEFRA information as well. So one of the things that I would like to just talk a little bit more about with the eligibility for Medicaid, and again, Roberta is going to get into this in great detail, but it just talks about people can be eligible for Medicaid in several different ways. We're looking at low income. There could be a disability, and we're also looking at home and community-based services that is attached to our Medicaid waivers. So you think about individuals who are in foster care. They have legal guardians who are having to submit these applications or do the renewals on their behalf. And so it's been a lot of catch up for parents, custodial guardians. You're looking at Office of Children's Services, OCS worker, foster care placement. So there's a lot to do. The Department of Public Assistance really has a lot cut out for them. So Roberta, I'm going to let you take it away and get into all of the great information about Alaska Medicaid.
Okay, great. Thank you, Lisa. Well, thank you, everyone. And so just want to start briefly with what is Alaska Medicaid? And so Alaska Medicaid is an entitlement program that assists Alaskan individuals and families with healthcare coverage. And it's jointly funded by federal and state governments. The Division of Public Assistance, DPA, is responsible for determining the eligibility of individuals and families in need of Medicaid benefits. And Medicaid has different categories, and those include Medicaid expansion, family Medicaid, breast and cervical cancer, Denali Kid Care, under 21 Medicaid, adult or public assistance related Medicaid, nursing home Medicaid, home and community-based waivers, and then TEFRA. And then each of those categories on top of that has their unique eligibility rules and guidelines. So sometimes it can be very confusing and a little overwhelming with all the different things that you need to be aware of. And so one of the things is you need to be enrolled in Medicaid if an individual is pulled for a home and community service-based waiver. Even if someone has benefits through their native corporation, they still need to have Medicaid in place when they're pulled for the waiver waitlist. So how can I apply for Medicaid? Well, we're going to make a distinction between if you are a first-time Medicaid applicant. Okay, so we're going to handle that first. So if you are a first-time Medicaid applicant, you could apply in the following ways. One is to go to this website, healthcare.gov, to apply for a healthcare plan or Medicaid through the federal marketplace. Or you can go to my.alaska.gov to do an online application through the Division of Public Assistance self-service portal. Or you can download an application at this site, and the form is called a Gen 50C, and that's for first-time Medicaid applicants, okay? And you can mail it in or drop it off at a public assistance office. And if you are applying online for initial Medicaid applicants, not renewals, okay? So I want to be clear with this because this has caused some confusion for some individuals and families. So if you're applying online for initial Medicaid applicants, not renewals, you could go to myalaska.gov to do an online application through the Division of Public Assistance self-service portal. And it's this portal that's actually, you could go to the My Alaska page and it will bring you to this site. It's the Aries self-service portal, and it's an easy way to apply for Medicaid medical assistance, and you could do that as a first-time applicant. Okay, so like I said, this is for applying for Medicaid the first time, not for renewals. So then we go to first time applicants, the state of Alaska DPA Medicaid electronic application walkthrough. And it's a great video. It is 12.5 minutes long, but I would suggest taking a look at it. It could be really helpful on how to fill out an electronic Medicaid application for children under 21, pregnant women, parents, or caretakers of children under 18, and adults between ages 19 to 64 who are not receiving Medicare and may be eligible under the Medicaid expansion can also apply for Medicaid online. If you want to do an initial Medicaid paper application, this is where you can download it from this site here, and you can complete it, mail it in, or drop it off at your local public assistance office. And if you do not have access to a computer or printer and you want a paper um, form, you're more than welcome. You can get it from the lobby of your local DPA office. You could also go to your public library, your public health nurse, or you can come into an ADRC, Aging and Disability Resource Center, and they have one through the municipality of Anchorage. Or you could go to Links in the Matsu Valley, and their ADRC would have it as well at the Matsu Health Foundation building, or you can get it through us at Stone Soup Group. And the DPA office hours, their lobbies are usually opened between 9 a.m. to 4 p.m., Monday through Friday. But there are some that they may have some limited service. So the one in Matsu, for example, they have certain days and certain times. So please check for their availability. Or you can call at the virtual contact center, this 800 number, 800-478-7778, Monday through Friday, 8 a.m. to 5 p.m. Yes, there is a wait with being online and, for the phone. So I would not suggest doing this during a 15-minute break. It's going to be where you're going to have to take some time to be patient, wait. You will get answered. There have been some times when people have had to leave a voicemail there, but it will be returned. This is a listing of the offices statewide. If you notice, there really isn't a direct number to each of these offices. It all has the 800 number, or they don't have even that number listed. It is just a email. I would suggest emailing is a good route to go sometimes if you have questions, because it also gives you a paper trail, and you could also follow up, and it gives you a track of how long it's taken them to answer. And if you need to include other people on your email, you could do that, or if you need to include documents. So sometimes that can be a good way to do correspondence with public assistance as well. This is a Gen 50C form, and it usually, when you get it, it's a white colored form, and it has some blue on it, and it's a little thick, but don't let it discourage you. You can get through it. And I did want to highlight on the front, it talks about how Medicaid offers this medical coverage. You could also, with this form, apply for it not only for public health insurance, but for other services that you may be interested in through public assistance. And I would suggest, if you are doing this paper form, please make yourself a copy after you fill it out and keep it. Because for some instance, let's say, for example, we don't have your form. It says that you sent it in, we don't have it. You have a copy, or let's say they did receive it. Okay, let's think positive. They did receive it, everything went well, and then you're going to do an interview with them. You'd have your form to answer their questions directly. You'll know exactly what you answered. You'll have your information there, and the interview could go a lot faster. With this, some of the information you are going to need to provide a copy of is a copy of a birth certificate for who's ever applying for Medicaid, a driver's license or a state ID, a benefits identification card. If, for example, let's say it's maybe your child that you're applying for, or maybe it's a young adult who's 18 and they're applying for it, and they are applying for themselves and their family. It's not for family Medicaid. Okay, it's just for them. And it may be good to have, it's fine if they also have their parents' insurance as well. That's okay. You could still apply for Medicaid even if you have other insurance. And so, for example, you may need other supporting documentation, such as an agency letter showing money received, such as Social Security, veterans benefits, child support, alimony, unemployment, and retirement. Other documents that may be required would be bills or receipts for different things. Maybe you're looking for childcare assistance. And then also, if maybe you need assistance with utility assistance or with rent, there may be where they may ask you to bring in an eviction notice or shut off notices from the utility company, if that's something that you're looking through public assistance. So this is the first page, and it gives some demographics. And so one of the things is they're going to ask for basic information. If you are doing this, since this is transition series, I would take it that if you have a young adult who's 18 or older and they want to apply for Medicaid, even if they're living with you and a whole bunch of other people, doesn't matter. They will be considered their own household. They will be a household of one. So if you were just applying for your child, then when you fill this out, you're helping them fill this out for them. You're not putting your information down. It is for them. You're not counting your income. You're counting just their income. And most young adults do not have a lot. So just remember that as you're filling this out, even though we've all probably filled out hundreds of forms before, if you have to put a sticky note in front for your child, filling this out for John, filling this out for Mary, so you don't just start writing your stuff down. So, you may say, oh, I'm not going to do that. Well, sometimes it does happen. So, because we all have a lot of things to take care of. So the people in your household, this is where I was sharing about, if you are applying for your child, helping them apply, then the thing is they are a household of one. So you would not put in there all of anybody else. It's just for that child. It's just for their one household. Now they can be on, for example, your tax return. That totally is fine, but they still are a household of one. And I'm going to go to the next questions here. So you're going to see it says, let me go back one. It says this is for person one, the main person, and then it says person two. We're going to go to person 3 and 4. And the thing is that it is for those other people, or it's like if you're doing family Medicaid and you have, it's a family and there's parents and children, that's what that would come in. Okay. But if it's only for your child and you're only applying for them, then you would just put them down. Income in your household, if your child does have income or the person applying has income, this is where it would go. And then we have here where answer the following questions about income, and it goes through some different things. And then if you go towards the last quarter of the form here at the bottom, it talks about, for all the items checked above, please fill in the boxes below. And I have right here where it says individual's name, and then here it says State of Alaska PFD, and there's 2 spaces that are open, and then the word annual. Well, we don't know what our PFD is going to be until we get it, correct? So the thing is, this is like the best way to answer it. Put your person's name there, and then put State of Alaska PFD, and just put annual, and that's it, because we don't know what we're going to have. It changes all the time. And then here, if in let's see here, it talks a little bit about if there's going to be employment changes. They want to know about changes to income, and so this is where you'd answer those questions. Then if you have Native benefits, or if you are Alaska Native or American Indian and you have that heritage, then you would answer these questions and you would have to give some other information as well, like your corporation name. And if you do receive some type of benefit, a monetary benefit, then you could write it down there. And then your family's health coverage. Now, for some families, they do have one of the family members does have coverage through a job, let's say, so they could write that down here. And if a young adult is applying for themselves and they also have insurance through mom or dad, they can put that information here as well. That's not going to hinder them getting Medicaid. Okay. Now, if somebody is just applying for health insurance only and they don't want to at that time apply for food assistance, utility assistance, or other things, and all they're interested in is the health insurance, then they stop right here. Okay, they just stop this form. But if they are want to apply for what they call MAGI or modified adjusted gross income benefits, then they're going to continue on in the form. And the MIG or MAGI, modified adjusted gross income, it's the IRS's calculation of income and household size. And this will be used to determine eligibility for health insurance programs, including Medicaid and Denali Kid Care, as well as a premium cost sharing assistance for tax credits provided for low and moderate income individuals under the Affordable Care Act. And these are the types of Medicaid that would be under the MAGI, the modified adjusted gross income. And if that's not what you're, applying for, but take a look at all of this, as you're going through that application. And then the other thing is we have here releases of information that we need to be signed. For example, the person filling out this application will need to be signing it unless that they are have a power of attorney or they have a guardian. Then that would be the person signing it. See, we go to this one. This is where acknowledgement of understanding and statement of truth, where there would be initials in these areas, and then another signature here, verifying that what you had stated previously was the truth. And then this is for contact people and organizations. So sometimes if somebody's going for utility assistance, they're going for rent assistance, they're going for different things, this is where you may put that information down that these individuals, you're giving permission for them to be called. This is maybe how they need to, public assistance needs to have more information about you. Also, let's see, if you have a landlord and you're looking for, there may be certain questions as well. Certain things they may need to say, like, oh, are they really paying
Yeah, Andrew got it.
1,000 a month for their apartment? Is that truly true? So do they have a lease? Can we please see that lease? So those are some of those questions there in that information. So just remember, whenever you're asking the government or anybody for stuff and you're asking for monetary, the more that you ask for, the more documentation and supporting documentation you have to provide. Okay, so which is not a bad thing, but just be prepared for that. People want to know why are you asking, and then
Guess
they
what?
want you to have
I'll put that in.
documentation
Put it in
to
Andrew.
support that. Okay, and then we have this is the Appendix A and the health coverage from jobs. So if somebody does have, let's say, insurance from a job, or it's a young adult and their parent is able to provide them with some health insurance, you would put the information here. This is, you may need to get a little more information. It's just verifying that if it is through a job, this insurance is coming through, that they have done their due diligence, and just that they may ask for a little bit more information from Medicaid for that. And then here you can apply for voter registration if somebody would like, and that's a right that somebody has, and they can sign up here. And then also, this is Appendix C, appointing an authorized representative. And I wanted to read that to you because if you would like someone to represent you on all matters related to your application and case. So, for example, you can give a trusted person or an organization permission to talk about you and your application with public assistance. And this is called an authorized representative. All right, they can make changes to your public assistance case and can access the information in your case, but you will be held responsible for any changes that's made by your appointed authorized representative, and up to including potential fraud. So just because somebody else is making decisions for you, you have to trust that they're going to make the right decisions. And the Department of Public Assistance can release information to them. And also, this is if there's other places that need to have information and you are authorizing that, you can put that in. If you have someone who's already your representative, either a power of attorney or a guardian, then you're going to need to supply a copy of those papers as well. And then this is for child support information. If somebody is adult and they're involved with that. And again, voter registration. And now we're back to, this is about the Medicaid renewals and staying covered. Lisa, did you want to go through this, or would you like me to?
So we will send you this flyer. I'll email it to you tomorrow. But it really does provide really important information, 5 things that you should know about your Medicaid renewal. And it just talks about keep your contact information up to date, monitor and respond to mail. I think a lot of it's just coming regular mail. I don't think a lot of it will come certified mail. Is that correct, Roberta?
Yes.
Okay.
And I just wanted to, can I mention something quickly
Oh, yeah.
about this?
Yes.
So one of the things is Lisa had mentioned in the beginning of the presentation about individuals who had moved. So what happened was, when Medicaid were doing this rewinding, Lisa had mentioned before with making sure that you have your accurate address with them, because Medicaid was trying to be helpful and they were going back to the last known address that was registered for that person. So if the address was correct, then great, they got their mail. If it wasn't, there was a potential that they were not going to receive it. So it's really important to stay on top of that. And I think Lisa was going to mention with their number to do that.
They talk about the process is easy, and this is just for renewals, and there is help along the way. It talks about how the renewal packets come. Can you go back to the?
Oh, I'm sorry.
So it talks about the renewal packets are pre-populated with your information, but really make sure that the information is correct. And if it isn't, of course, just make the corrections. And your children or child may be eligible for Medicaid, even if you are not. And if you, by chance, get a denial, you have the right to appeal it. Thanks, Roberta.
Oh, no problem. And did you want to talk about this little timeline? I think you kind of covered it, but
yeah.
okay.
And Roberta has as well, with when she talks about the application, it just talks about from the time the automatic process from, it talks about beginning April 2023, the Division of Public Assistance will attempt to send out Medicaid renewals using their electronic data source systems 60 days before the end of a household certification period. And like Roberta said, the last address that they have in there is where that notice will be sent. And so it kind of gets into it, if it's automatically renewed, if it comes back, so it just talks about checking your email, your mail, and if you have any questions, contact DPA.
And no matter what, it will always be the Medicaid recipient's responsibility to contact DPA if they have not received their Medicaid renewal. So, for example, if you say, oh, I didn't receive anything in the mail and now I'm getting this closure letter and so forth, they will come back to you with, it was your responsibility. If you knew when you were going to be having a renewal, when that came around that same time during the year, you should have contacted us. So just be aware of that. They are not, Medicaid is not responsible for your renewal. You are. And so if there was, for example, something that happened that you're like, listen, I received this way past the date, or I never received information, you always have the right to do what they call a fair hearing rights. And you could request a fair hearing within 30 days from the date of your notice. And you can make a request in person, by phone, or in writing. And you should do that. If something like that came up, please follow it through with something like that. Contact that virtual contact center number at 800-478-7778, and or go to staycovered.alaska.gov. And Lisa, I was going to go into the renewal form, and unless there was something else you wanted to mention at this point.
No, go for it.
Okay.
Thank you.
So this is, so remember before when I first started out where I said that there is a differentiation between the initial Medicaid application for when you initially apply and then the renewal form. So it's called the eligibility review form, and it is a Gen 72, and it's not like the other form. And this is what you will be filling out for an eligibility review form. So they'll go through the information, and the first form deals with, the first page deals with demographics. Then it's going to talk about your household, who is in your household. If it's just for one person, then it's just going to be for them. Even if they live with a lot of other people, it's just going to be for them. Let's say it's your young adult child. They're just applying. Even if you're a family of 12 and that child is part of that family, they are still considered a household of one if they are applying for Medicaid by themselves. So these go through a series of questions, and as you're going through, please answer in mind, if you're helping your child with this, that it is for your child, not you and the rest of the family, unless you're applying for family Medicaid. But if it's just for the single person, please keep that in mind. And then this is where you would list assets and also accounts. And then it's for a listing how much money is in your household, what do you have in cash, what do you have in bank receipts, different things you can go through. If anybody belongs to a native corporation, they would list out the information here. They just want, the thing is that they want to see where, if there has been changes in income, if there has been, where it would affect somebody's eligibility for receiving this health insurance. And then goes further for other household expenses, health insurance coverage, sorry. Right here at the bottom, it goes again into those questions like, do you still have health coverage through another person or somewhere else? And you can list that here. And then on this page, it'll talk about some further questions with an acknowledgement of the truth and where you have to sign. And then contact people and organizations can go there. And then this is where that extra information, if somebody has health coverage from somebody else, that can be put here. And then if they have appointing a authorized representative. And then it also mentions in this paragraph that you can appoint, withdraw, or change an authorized representative at any time. And if you even need to change your authorized representation, contact DPA, Department of Public Assistance. And also, if someone is a legally appointed representative for someone on that application, then you need to provide proof, but you don't need to complete that section. And then rights and responsibilities. And it talks a little bit about some different questions people may have. And then they're just telling you what happens if you don't follow the rules. And so one of the things about Medicaid renewals is they do have a frequently asked questions page. and it is really very good. I would suggest you going there. This is the web page. And as I was going through it, I was like, oh, they answered this question. Oh, and I thought, oh, they don't have this question. As I go kind of like through the other questions, and I kept going down, down, I was like, oh, yeah, they did answer that. They did answer quite a bit. Now, you may have, a unique question, particularly your situation. Of course, contact them. Like I said before, email them or go down to your public assistance office. But check that page first, because you may be able to get some of the answers that you may need, and you may not need to go further. You may have that information right there. Another good thing is sign up for email updates at this website here, and it's from the Division of Public Assistance, and you can get news about Medicaid renewals and other benefit information. I would suggest, if you haven't received one already and you want to know more about what Medicaid can and cannot cover, please get a Medicaid recipient handbook. Here, they're offered online. You can go to this website and get it. And also at Stone Soup Group, we also have that same downloadable Medicaid recipient handbook. We could send you the link. And so it's really good. There was some new services I found out about there. There were some things that I learned about where what can and can't be covered. And so check it out. It may be a very good reference for you. And then also, this is about TEFRA. And TEFRA is a Medicaid program that was developed with special requirements that may allow children who would not typically qualify for Medicaid because of family income to receive specific Medicaid benefits. And TEFRA, if you think about it, it's like another door for for a child to get Medicaid. And it just counts the child's needs, and it does not count the parent's income. And there are some requirements. One is the child needs to meet the medical, developmental, or psychiatric condition that fits the supplemental security income definition of disability. And only the child's personal income and resources are used when determining eligibility, not the parents. And not all children who are determined disabled have high medical costs may qualify for this program. So there still needs to be an eligibility that someone has to go through to see if they meet that level of care. But the thing is, the age limit for TEFRA is set at 19 years old, for actually at the 19th birthday for that person. So it's expected that at age 18, a TEFRA child or the child's parent should apply for Social Security, supplemental Social Security income, and then move to adult or public assistance and related Medicaid prior to turning 19 years of age. Usually people have TEFRA care coordinators that help them with that, and they will have a discussion with you as your child becomes closer to 19. But you should be aware of that. And then before they become 19, look at applying for them individually for Medicaid. And Denali Kid Care and TEFRA Medicaid provide the same Medicaid healthcare coverage for a child. And a TEFRA care coordinator can assist with the initial process of applying for TEFRA, as well as the annual application. And if you need a list of TEFRA care coordinators, they're actually all over the state of Alaska. And we'd be happy at Stone Soup Group to help get you a list of those TEFRA care coordinators that you can contact. The other thing I wanted to say, if a family is already on Medicaid, then you're good. You don't have to have your child apply for TEFRA. It would only be, sometimes families have had where they were on Medicaid because of maybe COVID. And then when that ended, and with this Medicaid unwinding, they may not qualify as a family, but their child still needs to have coverage, and they may qualify because of their needs, whether it's medical, developmental, or psychiatric condition that fits that supplemental Social Security income definition of disability. So they may have want to get a TEFRA care coordinator to see if their child could qualify for that. Oh, okay. Thank you. Thank you, John. And so, one of the things is I wanted to let everybody know that it takes a team effort to process a TEFRA Medicaid application. And I wanted to go over this quickly with you, but for parents, your main job is to make sure the application process moves forward by supplying the required documents and working with your TEFRA care coordinator to track the progress of your child's application. As a parent, you're going to be responsible for making sure that the initial and the annual financial eligibility forms are submitted to DPA in compliance with the specified timelines. There have been times where we all get overwhelmed, things come up, and you're like, oh, is it time again to put in that application? And maybe, DPA sent you a reminder, maybe they don't. So it's up to you. If, for example, put on your calendar, if you applied for it in June, I would make sure, I contact DPA and say, listen, am I gonna, should I look for June or May to reapply? Is that what I'm looking for? And get from them when that renewal should be taking place. So that's your responsibility. Like I said, DPA, they will always say it's your responsibility, not theirs. Okay. Because you have the information and it's your right to pursue it. And so your TEFRA care coordinator, they're going to be that awesome resource to help you navigate that process. And they'll act as that main point of contact for the agencies involved in the TEFRA eligibility process. And they have access to the various application forms that need to be submitted. And there's a department, DSDS, which is Disability Determination Services Department, and they have a list of TEFRA care coordinators that a family can access to choose their TEFRA CC. And like I said, you can get that list from us if you'd like. The Division of Public Assistance, or DPA, is a central agency for all TEFRA Medicaid eligibility decisions. And when checking for financial eligibility for TEFRA Medicaid, the DPA does not count the parent's income or resources. Okay. The DPA will verify your child's income and resources to make sure they don't exceed income standards. And DPA will make a referral to the DDS, or Division of Senior and Disability. I'm sorry, for DDS, Disability Determination Services. Sorry for that. For a disability determination, and make a referral to Co-Imagine Health for medical determination. Okay, so we talked about DDS, Disability Determination Services. That completes the state-only disability decisions for the DPA. And using the same federal Social Security regulation that's used for SSI. So to be eligible for TEFRA Medicaid, your child must be determined disabled by Disability Determination Services. Okay. Then we have the Division of Senior and Disability Services, the DSDS, and they complete an ICAP assessment. And that's an objective scoring tool used by an assessor during an interview. And it's based on a referral from Co-Imagine Health to determine if a child meets a certain criteria or level of care. And then Co-Imagine Health, they are the contractor employed by the state to review the TEFRA applications for state-defined criteria. So what we have here in Alaska may be different what they have in Missouri, okay? Because it's a state program. There are a lot of things that they do the same for Medicaid, but because it's state, there are some differences from state to state. Okay. So Co-Imagine, they're here in Alaska, it's Co-Imagine that we contracted with to review these applications that meet state defined criteria, Alaska state defined criteria. And they track the progress of all new and renewal TEFRA applications. And then once Co-Imagine receives all the application documentation from the TEFRA care coordinator, they will review the application to see if it meets the criteria, the state criteria, or the Alaska criteria for the program. And then Co-Imagine Health will notify the individual's TEFRA care coordinator and DPA of the final TEFRA eligibility determination. So it is quite a bit of a process, but there is light at the end of the tunnel, and there are lots of children on Tefra, and their parents have successfully completed the initial application and successfully complete the renewal process as well. And I also want to mention that for the Medicaid part of it, for adult Medicaid, the many people who have successfully did the applications, the initial ones, and successfully did the renewals. And I know it can be a little daunting at times, but we're here to help. And we could help direct you towards getting those answers and help direct you towards the resources that are made available through Department of Public Assistance to get those questions answered. So if anybody has any other questions, we can talk about that now. And I'm going to stop sharing my screen. That's okay. And I saw, oh, thank you. Thank you very much. And congratulations. He's turning 18 soon. That's awesome. That's wonderful. And so if there's any way we could ever help, please give us a call at Stone Sioux Group. We'd, love to help you. We are not DPA. We don't have a direct line to them. By calling us, I'm sorry, I wish we did, right, Lisa? I really wish we had like a direct line. And each one of us, if our family members need to apply for this, we get no special treatment. We're just the same as well. And so does anybody have questions at this time, or information they want, or something else explained? Or there was a lot of information. Everybody, thank you for your patience, everybody.
A lot of good information.
Yeah.
Thank you, Roberta.
You're welcome. Thank you, Lisa.
Well, then we will go ahead and end our series tonight. Thank you for showing up and being here with us tonight. We really appreciate it. We will be, excuse me, on hold. We follow the school schedule. So we are officially on our summer break, and we will resume again in September. So keep an eye on our calendar. We will have a whole other series going into September, and great topics.
Lisa, I think I had a question. Do you have a question?
No, I was just saying thank you.
Oh, thank you. I appreciate that.
Yeah.
Thanks so much. I'm sorry. I'm not very well versed with all the emojis. So thank you. Appreciate that. And thank you, Paula, and thank you, Beth. Appreciate it. So
All
have a
right.
great night.
Thank you
Bye.
for next time.
Bye.